Yesterday, we learned that the damage from Friday's attack on the CDC headquarters was much greater than we first thought. Two sources within the CDC referred 11Alive to an internal meeting which detailed at least 181 bullet holes found in 4 buildings and a guard shack. Fortunately, no CDC employees were physically harmed, but a DeKalb County police officer, 33-year-old David Rose, was fatally shot while responding to the scene. Health and Human Secretary Robert F. Kennedy Jr. paid a visit to the CDC headquarters. Later, Kennedy visited with the DeKalb County Police Chief and met privately with the widow of Officer David Rose. Secretary took to social media to issue a statement saying, "We are deeply saddened by the tragic shooting at the CDC's Atlanta campus and took the life of Officer David Rose. We stand with his wife and 3 children and the entire CDC family." There have been 21 permanent directors of the CDC since the agency was created back in 1946. Today, we are bringing in one of the past directors to share his thoughts on and emotions on what took place over this past weekend. Joining us now is Dr. Thomas Frieden, who has served as the CDC director from June 2009 to January 2017. Welcome to the show, Doc.
Great to be with you, Chesley.
All right. First of all, give us your reaction of what happened, when you heard what happened at the CDC this past weekend.
My heart goes out to the family, friends, and colleagues of Officer David Rose and to everyone at CDC. We stand with you, we honor your service, and we hold you in our hearts. It's a horrible thing to see people who dedicate their lives to protecting others come under attack. And I think this is a moment to step back and say, whatever you believe, reject violence, listen to others, especially others you don't agree with, and let's figure out to turn down the emotional volume some and to move forward together, because this kind of violence doesn't solve anything. It's a problem, it's not the solution, and we need, as a society, to be able to listen to each other and to respect each other's beliefs.
Yeah. Doc, talk to me about the culture inside the CDC, and did you feel safe when you were there?
Well, I'll tell you, when I was CDC director, every epidemic intelligence service officer and hundreds of other staff responded to the Ebola outbreaks in West Africa, the world's first Ebola epidemic. It was a very stressful situation, and the president of Liberia, one of the 3 affected countries, President Ellen Johnson Sirleaf, said to me, when all the rest of the world was running away from Liberia, you and the rest of the CDC staff were running toward us to help. And when I thanked one of the many CDC staff who had been there for months working, what he said to me, I'll never forget. He said, "I want to be able to tell my children what I did in the war against Ebola, just as the older generation is proud of what they did in World War II." So seeing the attacks on people who are there to protect us is really terrible. We need to protect the people, health workers, public health workers, who protect us. That's essential for all of our health.
Yeah. We're hearing that the suspect reportedly acted upon some false beliefs about vaccines. How big of a threat is health misinformation to both the public trust and safety? And are you shocked that it turned deadly?
Well, on the one hand, we really don't know what all of the shooters' motivations were. We do know there are a lot of falsehoods out there, and some of them, unfortunately, are coming from Secretary Kennedy. Many of the things that he says are simply not true. It's okay to have your own opinion, to say, I don't want to get this vaccine, or I don't trust the data, but making up things and saying things that aren't true, it doesn't help anyone. And we really need to try to get back to where you can disagree about opinions, but we should be able to agree on what's certain and what's not certain in the facts. But I think the more important issue here is just to emphasize that we stand with the people of CDC. We mourn for Officer Rose and his family, and we hope that this will be a turning point to turning down the violence. We have seen enormous attacks on public health and healthcare workers all over the country. It's a real risk. It's a risk not just to people doing those jobs, but it's a risk to the people who those people protect. It's a risk to all of us when we don't allow our health workers, whether they're nurses and doctors or public health workers, to do their jobs, we are less safe.
Yeah. And what lessons should lawmakers take from this incident when considering funding for public health, security, and outreach?
Well, safety first. We have always said in public health entities, safety first. Our staff need to know that they are safe when they do their jobs. And whatever that takes, we need to make sure it happens. There is a certain irreducible risk. There are certain things you can't avoid. If you go into an outbreak zone, you might get infected, though we take every measure possible to minimize that risk. But certainly the people who dedicate their lives to protecting the rest of us shouldn't have to worry about being attacked for doing their job.
Yeah. Dr. Thomas Frieden, thanks so much for joining us. Thank you for your insight today. Really appreciate it.